So I want to play a game. It's called Bet You Didn't Know.
Okay, let's do it. I love this game.
So I bet you didn't know that you don't have to be married to an entire team under one institution. You can pick and choose the surgeon that you want, the plastic surgeon that you want, that may be in a different place than the medical oncologist, even the radiation doctor.
I knew I would love this game. I knew I would love this game. So true. We get so many patients who realize actually there's so much to gain from maybe going outside of your system. And you can love the oncologist, for example, that you have in your community, but say you just didn't vibe well with your surgeon, or you feel like, I don't know if they gave me all my options. You don't have to stay within the same system. There's no rule. You can choose another system, you can choose another duo, and with the advent of really high-end electronic medical records, we don't miss a beat.
Right. We have access to wherever you were. For us locally, we can communicate into the system of UCLA, of Cedars-Sinai, of the Providence umbrella of multiple hospitals. So we still have access to your imaging, your pathology reports. We can see what your medical oncologist is giving you medication-wise, what the last PET CT showed, et cetera.
But even when it comes to the oncologist,
right.
or radiation oncologist, this is what we do. We take care of breast cancer patients all day long. And so we have this Rolodex of all of the best doctors in the area to help the patient come out of this with the best experience and the best outcome possible.
They can use different centers, different surgeons, and surgeons who are not all part of the institution where their medical oncologist might be, or their radiation oncologist, or their gynecologist, their internist. So you can have this larger team that's still interconnected and communicates with one another.
I always actually like to make the comparison. I'm like, you can build your own Justice League. We can go to the multiverse, we can go where you need to go, because bet you didn't know, just because you started care at point A doesn't mean you have to finish it there. And you may love your oncologist, and that's great, and that might be your community oncologist, but bet you didn't know you can keep that oncologist and still choose a surgical team outside of that system. Bet you didn't know that you can still get excellent, wonderful care without compromising a thing, and you might find a surgical duo or a surgical team that can offer you something that you weren't offered before.
Your own Justice League.
That's right.